Good morning, everybody. It's Mackenzie, and I am Dr. Wagen's assistant, and we're going to do a tooth talk today. So we're going to do this every week, I'm sure you know by now, but we're just hoping that we get some interactions from you guys because I know there's lots of questions out there, and we hope that you guys, can answer them all for you. So today, I'm going to ask Dr. Wageman how often we need x-rays for adults and children and how important they are and the types of x-rays versus a panoramic or things like that. All right?
Okay. So we're still in our protocol, so we got to switch because I'm asking. Hi, how's it going? So if I understand the question right, it's like how often do we need x-rays? And what's maybe recommended for kids and adults? Yeah, so we've got this principle in radiology because it's kind of like one of these weird things in dentistry where we know that the radiographs that we take have almost no risk associated with them. But it's the almost that gets us, because we also know that that kind of radiation, it has enough energy to sometimes, if it stops at just the right place inside of us, it can activate a molecule by bumping off an electron and putting a charge there, or breaking in a bond between things and letting that molecule sometimes attach to a different one nearby. And we call it ionizing radiation. It's a very, very small risk, and it's also what happens to us all the time when we're outside under the sun. That's why we get suntans. It's also how you can get skin cancer, because the more times that the sun beats down on us with the type of radiation that allows things to link up differently, sometimes those link ups happen in our DNA. And when the DNA links up differently, it's going to tell our cells to produce a protein based on that code, and when that protein spits out the readout, if things are different, it's going to give you a different cell. It's going to start doing different types of behavior. And what's really great is, like, how long does a skin cell last? Not very long. It gets made because of a nearby skin cell, pushed to the surface, and then you shed it as a dried up dead skin cell. And most of our cells in our body turn over like that. But sometimes we have a little piece of DNA that has the opportunity to get copied many, many, many times. And the quintessential sort of case for that is if you have a sperm and an egg DNA, and they come together and they make a whole you. And so we would really not like a little bit of radiation to make a change there, because it could have a dramatic effect. And so that's sort of the rationale behind, like, why we avoid doing some x-rays on pregnant women. It's not because the risk is high, but it's because the DNA that's sort of growing inside of you is going to get copied many, 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 many times. And why do I go into all this? Because it's sort of an unknown truth that if you're not having kids anymore and you're of an age where your cellular reproduction is slowed down, just got to be something good about aging, right? Well, this is one of those things. Your risk of radiation exposure drops dramatically, to the point where if you're in your middle to latter life and we put the lead apron on you, it's almost more medical theater than useful, because at that point we just don't want to say you're too old for this to matter. Having said all that, the principle of, like, the least amount that we need still applies. So ridiculously safe, but still we're not going to needlessly expose you. So that means that whenever we take a picture, there has to be a question that we're asking, the answer to which is going to be more beneficial than harmful. And when it comes to the type of x-rays that you get every couple of years, they're called Bitewings because you bite on this tab. That's useful because you get the top and the bottom, only the part of the tooth that you want to see, all in one x-ray, so super efficient. And what we're looking for there is that when teeth are touching, they've got, and this is what we talk about flossing, they've got this little space in there where it's above the gums but below the contact, and it's a perfect hideout for bacteria to create an acidic biofilm. And we start to see on the other sides of the teeth some demineralization happening, but we can't see it from any view looking at the tooth. So the x-ray shows us where that's maybe going into the side of the tooth, or maybe it's created a little cave and it's going to break in, and we don't actually see the cavity until there's a big massive hole sometimes and everything caves in. So the x-ray is like letting us look at a frequency that these things happen. And you can go from not being able to see a cavity to having something that you need to treat in about 2 years. And that's where that comes from. Now, does everybody have the same risk of cavities? So, you're somebody, and every time you go to the dentist, they find something that you need a filling for. You're high risk of getting dental caries, we call it. But you could also be somebody who, for the last 40 years, they've never found anything. And those people are out there. If you're not one of those people, then now is the time to gnash your teeth, because it's a lot of genetics, not just habits. So should both of those people have the same frequency of getting their x-rays taken? And I would argue, no, ideally not. But because it's such a low chance of something happening, we tend to sort of stick with the 2-year rule, just as in general, because it's still possible, and you hate as a dentist to miss something. Sorry, this is going long-winded. If you're a kid and you have baby teeth, what turns out to be true is that baby teeth take, a year or 2 to make, whereas an adult tooth takes 10 years of mineralization to make. What's also true is that a cavity in a baby tooth can happen much more quickly and much faster. They're often easier to see because kids' teeth are spaced out, so we're looking to see where are those teeth touching together, and we can't see what's going on. That's a really high risk spot. So for sure, for kids, we would maybe sometimes do every year, especially if they have a high caries risk, because we don't want to wait so long that that cavity could grow right to a toothache, and we missed it, and we missed the opportunity to do something less traumatic for little Johnny or Susie or whatever. There's other x-rays that we take. Sometimes only we take one in many, many years. One is called a pantograph, which shows like what's going on in all the tissues around the teeth, in your bone, your sinus. And we don't have to take those very frequently because we're not looking for anything that moves very fast. You might get 3 or 4 over your lifetime, more if you're in ortho. And there's reasons, but always there should be like a question that we're trying to answer when we take the x-ray. And always we think about take the least number possible. It should never be because we can charge for it and your insurance covers it. Like, that's not ever the reason. So if you feel like that's happening, just ask your dentist, like, why are we doing this? And if they don't have an answer, then say no thank you. Thanks guys, we'll see you next week. And yeah, we're busy making Smart Smiles happen in Peterborough. So again, if you know of anybody in Peterborough or the surrounding area who's looking for a dentist, come check out our website. Would love to see you. And have a great sunny day. It's summertime. Yay!